Hello, everyone. You're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. Okay, so today's topic we're gonna be discussing hypertension, prevention of hypertension, how we can prevent hypertension. Yeah. So let's dive into it. Like I always tell you guys in my video that I'm not going to be talking about the pathophysiology or how hypertension affect the pathophysiology. We don't need that. We don't need that. I'm here to talk about the prevention and also the signs and symptoms. Okay, so what is hypertension? Hypertension is the condition in which the force of the blood against the artery wall is too high and is forcing it can elevate the blood pressure. Okay, so what is the normal blood pressure according to CDC Control Disease Center in United States? Normal blood pressure for adults should be 120 over 80. So when you take your blood pressure, it should be normal, should be 120 over 80. When it's getting to 140 over 90, that should be hypertensive. And to diagnose hypertension is not one time thing. It's a thing that you have to consult your healthcare provider, and then they have to take the blood pressure multiple times for them to diagnose that, okay, yeah, you really have high blood pressure. Okay, but there are some times that you might have signs and symptoms that is really consistent, and then you go to the ER, then they'll be able to diagnose you with hypertension. So we're gonna be talking about symptoms. Let's talk about symptoms of high blood pressure. Like if you have hypertension, what are the symptoms that you can see? First, blurry vision. People with symptoms of hypertension usually have blurry vision, and these symptoms vary from individual. There are some individuals that they don't have the symptom, and there are some that have the symptom. You have severe headache. When I say headache, even if you use fever reducer, if you use the Motrin, Tylenol, those headache medication, it will not go. It's constantly like severe headache. You have fatigue. You'll be really, really tired, fatigue. You have heart palpitation. Your heart will be beating so fast. You have shortness of breath, like difficulty in breathing, and also you have nausea and vomiting. And sometimes some patients usually have sensitive to light. They are very, very sensitive to light. Okay, and then so those are the signs and symptoms. If you notice the signs and symptoms, please call for help. You can go to the emergency room, but if it's severe that you cannot call emergency room, or no, call 911 or go to the emergency room, please look for somebody that can drive you to the urgent care or emergency room. So those are the signs and symptoms that we usually see on patients with hypertension. Now, if a patient have elevated blood pressure and is not well controlled, or is not immediately controlled, it can lead to heart attack. And if it leads to heart attack, it can also lead to stroke. And in some cases, it can also lead to death. So you want to treat it as soon as possible. Once you're diagnosed with hypertension, please treat it. There are some causes. There are some things that we usually do as a patient that causes this hypertension. Let's look at the causes of hypertension. Sometimes, I always say it in all my videos that whatever you put in your mouth is whatever you get. If you eat high sodium, like a lot of salt, you eat too much sugar, you don't sleep, stressed, things like that, your blood pressure will be elevated. So if you can control all those things, trust me, you will not. And sometimes some people that are old, they tend to have high blood pressure as they grow older. But the major thing is when you smoke, you drink, alcohol consumption, you take too much sodium like salt, too much your obesity, things like that can cause hypertension. So how do we treat it? This is where I love that's why I create this kind of program. Okay, I always tell you guys, prevention, that's why I'm here. How do we prevent high blood pressure before it will even occur? We don't want to go into like, okay, what causes the what, how do we prevent it before you even get to the stage whereby we'll be talking about what causes hypertension. Okay, let's start. Hypertension can be reduced with medication. But before we go into medication, because it's going to be the last resort, let's look at what we can do, to prevent it, or what we can do if you already have hypertension. One, exercise. You see, exercise is very essential. Exercise can reduce a lot of disease process in our system. We just have to be active. We have to be active, like really, really active. If you're not active, or you're like maybe a stay-home mommy, or you work at home, there are some basic exercise you can do. You can walk around your neighborhood. You can do like indoor exercise. Go onto YouTube. There's some exercise you can do, like move your body up and down. Even if you go to your healthcare provider, they will recommend that, okay, you do exercise maybe 10 minutes to 15 minutes 3 times a week. That's enough. You have to be very active, not rigorous exercise. You know how we go to the gym and you see people like doing exercise, and you be like, no. You can take a walk in your neighborhood, like that, 10 to 15 minutes 3 times a week. That should be fine. Okay. No, the next one is healthy diet. Like I said, healthy, whatever you garbage into your mouth is exactly what you will get. If you eat bad, it will affect your organ system, it will affect your mental system. You don't want that. So that's why you have to eat right. Eat right. In hypertension, you have to eat low sodium. Low sodium means, this is the time for people that have hypertension, they have to read labels. When you go to the store to buy some stuff like food stuff, especially seasoning, please read labels, because there are some seasoning that have like sodium that you don't even know. Now you have to be cautious of the food, the seasoning, how many sodium that you have in there. Please, you're not, make sure that low sodium, so watch it. And if you're diagnosed with hypertension, definitely you will have low sodium diet. In alternative, there are some instead of eating table salt, there are some salt that is recommended that you can take. Instead of using salt, there are some seasoning like that is recommended, but those seasoning also consist of high sodium. That's why it's not something that we tell patient to do. You understand? But in the nutshell, just make sure you read the label and make sure you have low sodium diet. Also, sugar intake, please. There are some alternative things you can use instead of sugar, and water. Just drink water. Drink a lot of water, drink it. Drink it instead of soda, all this Coke, Fanta, we can drink water, to substitute that. Healthy food like fruit, nuts is very, very good for diabetes. Things like that. We should just make sure we eat healthy. Lot of vegetable, protein, low carbohydrate. If you're eating rice, there's substitution for white rice. You can eat brown rice instead. Brown rice is very good. Instead of eating white bread, you can eat wheat bread. Wheat bread is very good. Oat, that is very, very good for the heart. Things like that. So just look at alternative. And if you're taking high blood pressure medication, okay, I think I will do part 2 of this. I have to go and do part 2. Okay, I'll see you guys in part 2. Watch out.